Good morning, everybody. Morning. Well, we are thrilled to be here today. My name is Cindy Samuelson, and I work with the Kansas Hospital Association. And we blew in from Topeka this morning and are so excited to be here in Hoisington for this award presentation. And just to kick it off, I'm just going to kind of be the opening and closing act here. So just wanted to give you a little idea of what we're going to cover today in the program. And we will have some time for questions at the end. But I'm going to kind of do some introductions, and then I'm going to kick it off to some other staff who are going to talk and highlight the program. And at the end, if you guys have questions you want to ask about anything, we can take a few questions. And if you haven't noticed, we have some great things to eat, too. This is all about healthy eating, and we're thrilled to be able to have this beautiful display of healthy foods. So without further ado, as I mentioned, I'm with the Kansas Hospital Association. We are the association for hospitals all over the state of Kansas. Every hospital in Kansas is a member, and we have a foundation, the Kansas Hospital Education and Research Foundation, which has numerous projects that they fund, one of them being the Healthy Kansas Hospitals Project. I'm thrilled this morning to introduce Melissa Hungerford, who's the CEO of our foundation, the Kansas Hospital Education and Foundation. She will kick us off to tell us a little bit about the work they do and the program. Melissa.
Thanks, Cindy, and thanks, Jim and the team, for such a beautiful reception here this morning. Brian, I mean, really, could we just skip to the food? It's so great. So I can just feel the excitement in the staff team here. So I'm really glad to be here to be able to kick this off and really recognize Clara Barton Hospital for the work that they've done. So KHA and KHRF, its foundation, believe that hospitals should be active in setting a healthy example. And certainly we can see how hospitals can do that here today. Hospitals are often seen as being here to respond to illness and injury, but in reality, we're here for the health of our community. We have an opportunity to influence healthy choices for our patients, our staff, our community, and all around us. So we really believe that we being the center of health in a community gives us that opportunity. Our food and beverage reaches all of those populations. So if we can give healthy food and beverage choices and provide that opportunity, we not only help patients in their recovery, we help employees in their everyday life, and in both of those ways, we reduce the need for and the cost of health care. So we really believe that this is an important thing. All of those reasons led us to apply for a grant from the Kansas Health Foundation. We have created the Healthy Kansas Hospitals Project as part of that grant. That's a collaborative approach between hospitals, the Hospital Association, the Foundation, and other organizations that hit health in a variety of ways across the state. Participating hospitals are provided resources, motivation, a lot of technical assistance to change their behaviors and actually change their policies about the way they provide food. So those policies impact the cafeteria, they impact vending machines, and they impact even employee meetings. And I can tell you that if they impact it this way, there are a lot of folks that would want to come to an employee meeting. So we're really proud to be able to do that. And I do want to reach out to the Health Foundation, the Kansas Health Foundation, and thank them for the funding that really gave us the ability to do this. They are about improving the health for all Kansans, and that's certainly a vision that we can share, and I know that Clara Barton shares. So KHRF focuses on projects that do three things: provide leadership, share knowledge, and leverage resources. And this project really does all three of those. We also are here, our mission is to facilitate collaboration and innovation. And this is one of those projects that just makes me smile because of all of the creative things that hospitals have done. If you met Clara Barton out here, and I'm sure you'll hear a little more about her, you can see the kinds of creative approaches that folks have done. Our project started in 2013 in July, midsummer, so we're going on our third year now, finishing up our third year. And we were, our overall goal to provide healthy behaviors in all areas, but food and beverage is really something we thought we could zero into. All too often, hospitals create opportunities to have not so healthy foods, and those of you who are of my generation know that we've had a lot of fried foods and other kinds of foods all along in our lifetime. So seeing this change is often, it certainly makes me smile, and I know how difficult it is to change that process. As of today, we have 78 hospitals who have signed a pledge to make changes in their hospitals, and we have 27 hospitals who have actually gone all the way through the process, including their boards, to adopt policies that say that this is the way that they're going to provide food for their patients, their employees, and the community. They've done a lot of different things. They've eliminated or reduced carbonated beverages in their cafeterias. They've provided non-sugary and sweetened beverages, sometimes even for free in their cafeterias, things like the fruit-infused water. They're offering and eliminating the deep fat fried foods, which are so heavy in calories and other kinds of things that are so unhealthy. And then they're using hard, healthy oils. There are a number of other things, and I'm sure that Jim and his team will talk about those things. So we are here to award Clara Barton, who's one of 2 winners, our Award of Excellence for this project. We judged them using not only the Kansas Health Foundation staff, but the American Heart Association staff and the Kansas Children's League staff in order to judge all of the applicants for this award. And they were judged on 5 different areas. They were judged on impact. Have they made a visible difference in their food and beverage? Have they been innovative? And you can see that they certainly have here. Did they provide leadership? And was their leadership supportive of all of the work that was being done in the facility? You can also feel that palpably in this room as Jim stands here and is so excited about the work that they've done. Are they making partnerships? Certainly, Clara Barton has done a lot to reach out in the community and make partnerships. And then will this continue after this grant project is over? And they've done a lot to make this an integral part of their organization. So let's congratulate Jim and Clara Barton and Jane and Brian and the team. So let's give them a round of applause for the wonderful work that they've done. My nose is running up here, I'm so sorry. Let me introduce Jim Blackwell. And I really can feel the excitement and the leadership that he's provided in this project. And nobody can describe the accomplishments that they've made better than Jim and his team. So Jim, why don't you come on up and take the podium, and I will sit down.
Thank you, Melissa, very much. You know, first of all, I would just like to say what an incredible honor it is to be up here accepting this award for Clara Barton Hospital. But I want to say thank you to Cindy and her staff at Kansas Hospital Association and KHA for beginning this project and giving us an opportunity to become partners with that. And actually, the timing for this couldn't be better because many of you, I don't know if you know, but recent reports that have come out from the CDC have indicated that obesity and diabetes are still on the rise. And even more so alarming is the fact that the death rate, preliminarily in their reports, are showing an uptick as well. And some of these things are being attributed to lifestyle changes. And that's the message I think that KHA and that our hospitals are trying to convey, is that lifestyle changes is what we need to do as a society to try to affect a more healthier outcome. We adopted changes in our policies at the board level to get things started here back in 2015. We adopted the Healthy Kansas Hospital Initiative by implementing the specific policies for the organization, and we were very pleased immediately to see the dramatic acceptance by our hospital community. And we felt like that was really the foundation of importance for us, is to start internally with our staff and build excitement for it before we went outside our 4 walls here. And this really is a great end result. And Brian, thanks. You set the bar. You know, he was going for visual here, but I must tell everybody, this really is to eat. So after we're done, please help yourself, okay? The one thing that we did after that was establish our wellness committee as part of our policy and procedure manual. And Jane Shepman, our chief nursing officer, was our chief architect with that. So I'll introduce Jane in the back. They're all identified by wearing their yellow shirts today. So Jane, accompanied by Michelle Mosier. John Durrett is here with us today as well. Casey Damel is in attendance. John Mosier, Carla Chrisman, and Cindy Rugen are all members of our wellness committee, and their primary focus is to find innovative ways to inspire nutritious lifestyles. And it's a great think tank. These guys are exceptional employees that represent the spirit of Clara Barton Hospital to come up with those innovative ideas. Next, our facility cafeteria. Many of you know when you go to a hospital, everybody kind of denotes their dining area as the kitchen or dietary. That's what it was here for Clara Barton Hospital, is where are we going to eat today? Back in the dietary department. And we thought to build excitement, we wanted to reach out to our employed population and put on a bit of a naming contest that was inspired and asked for by Brian DeLiesel, our dietary director. And we came up with a new naming convention for our kitchen, and it's now named Clara's Corner Cafe as the popular choice. And you'll see signage in the facility that directs public down to that area. But we also wanted to help build on the theme that we're providing healthy lifestyles back in our kitchen area. So Brian's done a great staff job with that, as well as his staff at modifying our menu to provide for more nutritional items. First of all, healthy entree options are offered daily with new menu items like fresh sandwich wraps, yogurt, and fruit parfaits. Future plans are being developed right now to include a smoothie bar with recipes that are popular with employees. That's something that we found. It was another great event that we did for our employees here is have a contest to see what kind of recipes they could come up with, and that generated a lot of excitement for us here internally. Also make readily available fresh vegetables and fruits that were always on hand, as well as as you see, the fruit-infused water. That's offered at no charge daily in our kitchen, and that's actually helped to reduce the sugary beverages or carbonated beverages as well that's offered and consumed back in our department. I haven't got the numbers on this, but I know that they refill these jugs quite regularly, and it's quite a popular item back in that area. Actually, years ago, we started this process with our foundation, was very gracious in sponsoring some equipment that we purchased called a steamer. And its primary goal was to help cook our food with less grease and oils and things like this, especially vegetables. And the goal is to help retain its nutritional values that are typically lost in your conventional cooking processes. And I think that was back in 2012 is really when this process started for us to change some of those processes back in our kitchen department. The next item, and I think what's very important, is once we accomplish things internally, is we wanted to take it to the road, is what we would like to say, and strengthen our healthy lifestyle concepts with organizations like the Barton County Health Department, local school districts, Be Well Barton County, and Town and Country Supermarket. You can see the Clara Barton likeness right here is a great visual aid that we have put up that the grocery store allowed us to put into their community that ties different selling items that they have in their grocery store flyer that tie healthy food concepts with a menu item there, and they're readily available. In fact, it's conveniently located next to the donut display. And I don't know who did that, but that was an exceptional technique there. One other key component is understanding that successful, healthy lifestyles doesn't stop with what's at the table. It's promoting and participating in physical activities, and that's an essential component to healthy living. We make stronger priorities in informing the public of events that are happening locally, like the Young Professionals 5K, Relay for Life, our very own Clara's Color 5K that we're going to do again this year. We have done that in the past, and most recently we had a couple of teams here internally sponsored with Walk Kansas. Many of you may be familiar with that, with the Kansas State University Coalition. We had two teams sponsored here. I think we had a total of 2,600 miles that was walked. We committed to do the perimeter of Kansas, and there was a lot of excitement and activity associated with that. So we also are looking for other events like varying walking events and possibly some sponsored bike rides down the road here. So we try to go out and be leaders in the community and practice what we preach, so to say. We have several individuals here in the organization that are very active in their lifestyles and very visible out in the community by making those things happen. Our passion is to present that lifestyle change so it can influence others. And the easiest part about this job and to have this type of excitement is the fact that we have a great core of employees here at Clara Barton Hospital that are valued in the mission of the organization, but very loyal to their patients in Barton County as well as Clara Barton Hospital and are part of the team. It makes my job easier. It makes my job a thrill to get up here and be a part of. And these folks with the Wellness Committee really exemplify that. So if I can, I want to introduce the main architect in this, Jane Shepman of our Wellness Committee that helped spearhead this. So please, Jane, come up and say a few words.
I don't at all consider myself the main architect. There's everybody on the committee are leaders. But when I try to think of how we got started with this, it was 2014, and I saw it in a KHA newsletter, and then I saw the symposium advertised, so I went. And there was a panel discussion, and there was fabulous networking. So I really was on board then. And I came back and started kind of talking, Michelle and I were talking about it. And then I went to a Kansas Organization of Nurse Leader meeting, and Josh spoke at that meeting about Kansas Healthy Hospitals. And I came back and said, we're doing it. So from there, that's kind of how we got started. We pulled a committee of people together, and everybody on that committee believes in our mission and are self-starters. Josh came out for a site visit in June of 15, and I think we had so much energy, but I think he helped us channel that energy, and he showed us some quick wins and kind of helped us with the policy, and there we went. Once we got the policy, and Brian came on board, and it's just gone since then. I think what feels really good about it is I know that we can sustain what we're doing. It's just natural that, you know, the healthcare within this organization is going out to the community. So that's it. That's my story. It's been really exciting for us.
Stay up here. Before these guys leave, if Melissa could come up too, I wanted to see if anyone had questions for Melissa or Jane or Jim. Anybody have questions for the folks here about the program?
Real quick, let me in. I
Come over here.
I neglected to do this. I just wanted to introduce Haley Finch. She is our Director of Education at KHA, and she is now the project director of this, and she's the one that really helped with Jane and others pull all this together. So, Haley, great work. Thank you so much.
Thank you. Question?
Yes, to Jim Blackwell. When the hospital began making some of these changes, how did the staff and faculty react at first? Was it a hard transition to make?
Jim, you might come over here because we're recording.
That's a very good question. That's one that we've been asked as well in the past, and you would think that everybody gets accustomed to having their goodie piles and where those places are at. I'm as guilty as the next person with that. Everybody in this room that's an employee here knows that. But when we offered this and engaged the employees here to participate in coming up with recipes and different ideas, and really a lot of hats off to Brian with coming up with some ideas of how to integrate healthy options with something that was fun to eat, but also was good. It tasted good. And fresh fruit and the different aspects that we have here are great accomplishments for that. So to answer your question, no, Jane had said it. It was very natural for us to adopt. It wasn't something that we had to force onto folks. Everybody grabbed onto this change, and it's been an exceptional ride so far internally. So that's why it's great to take it out to the public, because it's worked so well for us internally here with our staff.
We started with things like the infused water, and then we moved healthier snacks by the register. And I think as those first wins took hold, it made things a lot easier. Then we decided to try to tackle the sugary drinks. But people were just on board with it. I think the time for us was right.
Other questions? Well, I want to thank you all for taking time out of your very busy schedule to be here today. And we would like to actually formally present the check and get a couple pictures. And we have a large check that I'd like to get, but that's hard at the ATM. So we also have a smaller check. And this is actually one that Melissa can give to you to deposit. $1,000. I don't know if we said that, but this is a $1,000 contribution back to the hospital to help with this effort. So congratulations.
Thank you very much.